I used to go to KFC and just order bread. I wouldn't go get the chicken. I would just go get bread. I would tell people, I said, this is a body built by Little Debbie.
Craig Warren tells that story as he sits in the offices of the Williamson Health and Wellness Center. It's a place that taught him to focus on his health. But that wasn't always the case. When did you start having health complications with diabetes?
I'm 56 now. I'm thinking in my 20s. It's been a while. As I've always said, I'm lucky to be alive because there was things that happened for me having diabetes that I'm just grateful to be alive.
Diabetes was the first sign there was something going on with Warren's health. It was a warning light.
If your check engine light come on, I will be the guy that keeps driving because it ain't gonna happen to me. I'll be the guy sitting on the side of the road going, why does this always happen to me when I know it could happen?
Warren eventually suffered a stroke, a heart attack, and an amputation. His health challenges are not unique. West Virginians have some of the worst health outcomes in the country. And that reality is decades in the making. Today, we'll look at some of the reasons many West Virginians are unhealthy and why we should be paying attention to that check engine light. From West Virginia Public Broadcasting and PRX, this is Us and Them, the show that tells the stories about the things that divide us. I'm Trey Kay. Back in the days of the feuding Hatfields and McCoy's families and during the time of the mine wars in West Virginia, some outside journalists referred to West Virginians as flatbellies. Men worked in the mines and were very active. Plus, food was scarce in those times. But there was a turning point for the Mountain State. Today, people are much more sedentary, and they often rely on processed and fast food to feed their families quickly and cheaply. That lifestyle change has taken a toll and made some headlines.
Welcome to beautiful Huntington, West Virginia. Population 50,000, home of Marshall University, and recently named the unhealthiest city in America. In a place where nearly half
Back
of the
in
adults are
2010,
considered obese.
Jamie Oliver was known for his food revolution movement in the United Kingdom. He traveled to schools and revamped cafeteria menus with healthier options to reduce childhood obesity. The hope was that healthier kids would grow up to be healthier adults. That year, Jamie Oliver went to Huntington, West Virginia. Almost half of the city's population was obese, the highest in the nation at the time. On top of high obesity rates, 35% of the adults in the state had high cholesterol, and about a third were smokers. In 2010, those three factors contributed to more than 6,500 deaths from cardiovascular disease. While these things were serious, not everyone was a fan of Oliver's revolution.
I'm sick of talking about Jamie Oliver. I'm sick of talking about lettuce and carrots. I'm sick of talking about the whole damn thing. I mean, I wish Jamie Oliver would go back across the pond and never come to Huntington, West Virginia again.
But Oliver had a TV show to make and a mission he wanted to see through. Still, he was shocked by what he found in America's school cafeterias.
Are the fries counted as a veggie?
The fries count as a vegetable.
Right. Okay, when I found out that a French fry was considered a vegetable, it insulted me, it upset me, and it was a small little inkling as to why maybe we have all the problems that we've got. It's fairly obvious to see which
Watching a few episodes of Food Revolution, I can understand Oliver's dietary concerns. Much of the school cafeteria food was fried, and many of the kids preferred flavored milks packed with sugar. There was an infamous chicken nugget scene where Oliver threw leftovers from a chicken carcass into a food processor, added stabilizers, seasoning, and breadcrumbs, And then he fried them up and asked a handful of kids if they would still eat the chicken nuggets, knowing what's inside them. And the kids raised their hands. In addition to revamping local schools' cafeteria food, Oliver made a bet with a local radio host that he could teach 1,000 people to cook healthy meals. And that was the birthplace of Jamie's Kitchen, a restaurant and demonstration kitchen.
It was just a bit of fun to start off with, but actually it represented a lot more. If you look at the faces, the ages, to me it represented not 1,000 people, but what was possible if you put your mind to it. Thank you for your time today, guys. I really
Jamie's
appreciate
Kitchen is now called Huntington's Kitchen. And in 2013, Cabell Huntington Hospital took over management and oversight of the facility.
We, at that time, began to offer cooking classes, demonstrations, events, all designed to improve the health and well-being of our community.
That's Megan Archer. She's the digital marketing and media manager for Mountain Health Network, which oversees Cabell Huntington Hospital and Huntington's Kitchen.
In January 2016, just a few years later, we had a new beginning at Huntington's Kitchen with Marshall University's Department of Dietetics. They moved their classroom and their offices downtown, just above the kitchen, and together we've kind of shared this mission of improving the quality of life for residents of Huntington and our tri-state area through healthy eating and education. The beauty of Huntington's Kitchen is that we've really embedded this expectation that when you come here, it's not just to eat, it's to learn. So one really neat thing, not only with our Department of Dietetics and our students at Marshall, but we've got students at Cabell Huntington Hospital that are interns, and so they're dietetic interns. And they actually will be coming to some upcoming classes and presenting information. Say it's a class about the Mediterranean diet. So they may come in with a presentation about the nutritious benefits of eating a Mediterranean-style diet.
So how many people come here in a year?
In 2020, you would think we would have 0, but because we were able to open up our classes virtually, we actually served more than 20,000 people in 2020. Now, in person, when we went back to that, our average, I would say, I believe 2021, it was a little more than 10,000 people were served through, and not just the kitchen, but through our community outreach events that we do with Chili Fest and like some of these partnerships with Facing Hunger food banks. But in the class, we can have 16 people max. We have 16 stations, and we host anywhere from 5 to 10 classes a month. So just in this facility, you're talking hundreds of people in a month's time that may come in and have some sort of touch point with a nutritionist or a dietitian or a chef.
Okay, what do you know what we're making tonight?
It's Taco Tuesday.
Hey, do you guys like tacos?
Yes.
No, you do.
You do not?
No, I do not. He loves tacos. I hate tacos. I love tacos. I hate tacos. Taco Tuesday is always the day.
That's Leah Lowe and her twin sons, Chris and Matt. They were at Huntington's Kitchen recently for a Taco Tuesday cooking class. About a dozen families were learning how to make pico de gallo, guacamole, and ground beef for tacos. There were several families using healthy recipes to learn kitchen techniques.
What do you do?
My name is Kelly Brown.
Why do you bring your kid to Huntington's Kitchen?
We love it here. We've been doing the cooking classes for probably 2 years. We started doing them, and I'll bring her to the kids' ones, and then we'll also do them together. She and I, we'll come and do, when they have regular classes, we'll do those together. And we've made a lot of the stuff at home. We've did French toast before. We've did the meatballs. We've did their lasagna classes. They're doing tacos tonight, but it's really fun. It's family time. She enjoys it. The food's always great.
And then there's Katie Moore, who was there with her teenage daughter, Bailey.
So how much interest is there in your household around cooking meals?
Before the classes, none. But after the first class, she's very interested.
What kind of food does your family enjoy the most?
Stir fries, tacos, soups.
Are you from West Virginia originally?
Yes.
And I'm just curious, back in, was it 2010, it was said that Huntington, West Virginia, or Cabell County was the fattest place in America. You're smiling as I'm asking that question. How did you feel about that?
It was bad. Even when I was in high school, I graduated in 2008. So even then, they were trying to take out all the salts and peppers and, anything to make it halfway decent food. And it made you, back then we could order food from restaurants, so that's all we did. No wonder the food was disgusting. They tried taking out everything. No flavor, no nothing. So I can imagine now what it's like, honestly.
Are you bringing your kid here tonight because it's fun? Or are you bringing your kid here tonight because you want him to eat healthy or something else?
We originally done this to help her be more independent, I should say. She's getting at the age where we're trying to teach her how to adult. You know what I mean? And one thing she's taken from this class is actually cutting. She can cut vegetables and anything in a safe way.
How much of a role does she play in preparing the meals and even maybe choosing meals?
Actually, quite a bit. We've been doing that a lot recently. Before, she couldn't even cook anything in a microwave. So now she's got more confidence. She can do stuff for herself for once.
Are you worried or concerned about her being healthy and healthy eating?
Not with her, because she loves healthy food. I mean, that's just who she is. My son's autistic. He only likes certain things. Carbs, basically. No veggies, pizza, chicken, McDonald's. He is obese. So that does concern me.
How old is he?
He just turned 7, actually. So I think as he gets older, if he would have somebody with him, it would help him introduce to foods and be more willing to try new things.
What type of stuff did you eat when you were a kid? I mean, and was it like mama cooking carby stuff? And
I grew up on soup beans, a lot of soup beans. I'm from Wayne County. My parents didn't have much money, so we literally made soup beans last for a while, or chili, stuff like that to stretch. See what I'm saying? McDonald's was a treat for me. I only got it maybe once a month, so it's a lot different than every day now for kids. That's what they go to instead of home-cooked meals.
How do you feel about a kid who would go to McDonald's every day?
Not good. But everybody's got busy lifestyles, and I understand that. A lot of my friends order out. Grubhub is too convenient now. See what I'm saying? I mean, it's just, everybody's tired in the evenings. I understand that, but even myself and everybody else, I feel like meal prepping is probably one of the better things for us to do, but it's just too easy to eat out now. And I think that's the main problem. I think these classes are absolutely amazing for these kids.
Teaching healthy cooking techniques is at the core of Huntington's Kitchen. At times, the facility is also a community health center with early detection screenings for some diseases. Amy Gannon has her office right upstairs. She's Marshall University's dietetics program director and professor. For 2 decades, she's watched the rise of obesity rates as well as other factors that influence health in West Virginians.
I think the tipping point that I saw was probably in about 2010 when Jamie Oliver first came to Huntington. That was the year that Huntington was labeled as the, quote, fattest city in the nation. And I think that when that article ran, I believe it was in USA Today, it really put a media spotlight on this area of the state. And I think that's probably what the tipping point was. Of course, Jamie Oliver's food revolution was for television, right? And there was a lot of information in there that was hyped up for television. It was a reality television show, but it did bring to light the struggle that a lot of people have accessing healthy foods, preparing healthy foods, and what we sometimes see in the school systems.
So Oliver did his show from Huntington, which kind of made this part of the world not seem so great. And as you say, one of the benefits, maybe the silver lining to all of that, was Huntington's Kitchen. So tell me how this came about.
So the kitchen space itself was made for the show, but the space was more of a facade. There were ovens, there were sinks, but when we came here, many of them weren't even hooked up or working. So the hospital system took over the kitchen and had been using it for community outreach. When Marshall Dietetics joined forces with Cabell Huntington Hospital in 2015, we added a better ventilation system, more cooking stations. We hooked up all of the equipment that hadn't been used, and we really kind of dove head first into outreach with the teaching kitchen itself.
Gannon says it's important to recognize there are environmental factors that can also contribute to the state's health metrics.
A lot of West Virginia is rural. There's not always a walkable environment in all places. And so my clinical specialty has been working with children and weight management, children who are overweight. And what I have found as part of a team working with kids is that if you live in a more rural area, sometimes it might not be safe to walk. You know, if you live in a coal community in southern West Virginia, there might be large trucks that go up and down the road in front of your house. So kids, they might not have a place to go outside and safely play. If you live in an urban area, there might be a more walkable community, but you have to assess the safety of that community, how many playgrounds are in the area, and then the other environment, the schools, the policies, the advertisements that we see. All of that goes into the environment and many other factors as well.
Megan Archer with the Mountain Health Network says there are socioeconomic issues at play, too.
I think the fact that, a lot of our residents don't have access to affordable and nutritious options, that food insecurity element, I think a lot of it is culturally. We are taught if there are leftovers, you eat them. If you've got something in your cabinet, whether it's healthy or not, you're not going to waste not, want not.
Those cultural legacies can play an important role in health as well. Amy Gannon says some of the foods we grew up with are not very nutritious.
So if we go back to the standard meal of pinto beans, cornbread, and fried potatoes, one way that I help people to restructure that meal specifically is to say, look, on this plate, we want to reduce the amount of carbohydrates that you're consuming. Pinto beans, potatoes, and cornbread are all very starchy. When you put all of that together, and then over time, people become less active, they become more overweight, then you become more insulin resistant. And one thing leads to another, and all of the processed foods or all the high carbohydrate foods tend to cause you to gain more and more weight, and then the problem just snowballs.
What are some of the health challenges that West Virginians face as a result of less healthy diet?
Well, we really have high rates of diabetes in our state. In fact, the last data that I have looked at says that we are the number one state in terms of onset of diabetes, of type 2 diabetes. We also have higher rates of hypertension, which could be related, to the obesity, and then also kidney disease, which could be related to obesity, diabetes, or hypertension. So they all kind of go hand in hand. Cardiovascular disease is up there as well, also related to obesity, but could be independent of obesity also.
As a dietetics professional, what ultimately would you like to see change?
First of all, we need more access to fruits and vegetables. So a lot of people in West Virginia live in food deserts. So they live without convenient and reliable access to a grocery store that has fresh produce at all times. If people can only shop at the Dollar General, I want to see stores like that and similar retailers carry fresh produce for people. I also would love to see people develop cooking skills so they know how to prepare healthy foods beyond frying, beyond just meat-based foods. So how can you incorporate more fresh fruit, more fresh vegetables in different varieties, in different preparation methods to make them more acceptable to your family? How can you flavor beyond frying and beyond salt? So learning to cook with fresh herbs and different spices, learning different methods of preparation, and learning how to prepare more fruits and vegetables.
Discussing food and nutrition with a dietitian is one thing. Talking about obesity and health can be very uncomfortable for many people.
Does it complicate the issue when you talk about nutritious eating for health outcomes, and the people who are hearing it feel like what you're talking about is weight and body images? Does that complicate how this conversation goes?
It can complicate it because weight can be a very sensitive topic, right? And body image can also be very sensitive. But I like to tell families that I work with, and it often comes up when I work with a family, that one sibling has a very healthy weight and one sibling is overweight. And the mother will say, or the father will say, well, why should I punish, quote, unquote, why should I punish my healthier weight child by making them eat healthy? And my answer to that always is eating healthy foods is not a punishment. All bodies deserve healthy foods, regardless of weight. So whether somebody is overweight, underweight, normal weight, a healthy diet should be a staple, and it's a right for everyone, regardless of weight.
I caught up with Leah Lowe and her boys at the Taco Tuesday cooking class, and it seemed like their culinary session may have changed some minds.
Is it any good?
Yeah.
This is the one that said he wasn't going to eat it.
I said I didn't like tacos.
Looks like you're done.
Yeah. I'm saving the rest for home.
What do you think?
It's good.
Didn't you tell me before that you weren't crazy about tacos?
Yeah. Yeah, I didn't like them before.
But you were really involved in kind of mixing it up. So I don't know, maybe like there's a little bit of pride in your work, maybe?
Yeah.
And you're here with a friend, it looks like, so you get to be with your friends, right?
Yeah.
Do you also like the part that you're learning how to cook food that's healthy?
Yeah.
When we come back, we'll talk to health experts about how West Virginians can take control of their health. And we'll meet a man who had to learn that lesson the hard way and is now worried about the next generation.
My son was in high school. He was running fullback at 200 pounds. He had a doctor's appointment today, and he wouldn't let me see the weight. But I'm sure it was up. It was higher than 200.
I'm Trey Kay, and this is Us and Them. Our show is supported in part by the West Virginia Humanities Council and the CRC Foundation.
In difficult times, music gives us peace, brings us together, and helps heal us. It calms our nerves and brightens our days. That's why we're bringing you classic episodes of Mountain Stage on air and in our podcast. This is Larry Gross, host of Mountain Stage. Find something that's familiar or brand new and feel the power of live music on our website, mountainstage.org.
Hey, I'm Trey Kay, and you're listening to Us and Them from PRX and West Virginia Public Broadcasting. Diet and nutrition are just the start of the things that play a role in our health. There are lots of social and economic factors as well. Dr. Clay Marsh is keenly aware of this. He's been the Chancellor and Executive Dean of the Health Sciences for West Virginia University since 2015. Marsh says we've learned a lot about the factors that drive West Virginia's health outcomes.
What we know today, perhaps different than what we thought in the past, is that the way that you see yourself and that you perceive your place in society plays a really important role in a number of adverse health outcomes, as well as does not having a job and not having a level of education to allow one to be competitive for the job market.
In many ways, what determines that or what drives that? It could be economic, it could be educational, and could it be environmental?
Well, absolutely. But we know that perceptional is really, really important. In other words, people that perceive having traumas in their life early in their memory, in the 18 and under category, tend to have much worse health outcomes.
Marsh strongly believes that a positive sense of self-worth can drive successful health outcomes.
We are here to help anybody and everybody we possibly can, and we have a lot of talent in West Virginia, but ultimately, if you don't feel personally that your life is worth living, or your life has a future, or that you have connections that make you feel that you are loved and you are valued, and not just because of what you do, because you are alive, then we know that our ability to help you be healthier is going to be much more limited than if you see that you can live the life that you want, and then you reach out for help, and we can help you get there. But that difference between you believe and you pull us in to give you what you need versus you are, a victim to your circumstances only, and you're waiting to be rescued from that, then I think the former will be our new chapter. And the latter, I think, is where we've been, where people have lived in a world where they felt no hope, and we need to change that. And I think we are, but that to me is a critical factor in the health of our state in the future.
I feel like in West Virginia, there are factors that people can't control. For example, they can't control if a grocery store closed down, or they can't control that there may not be places year-round to exercise. And there's rising costs of food, fuel to get to the food. And I'm just wondering how you feel that factors into how healthy we are.
Well, I think that's certainly an important factor. And we know that in many ways the economics drive the businesses that are present in a specific community set, and that West Virginia has suffered because economically parts of our state have been impoverished over time, and that's certainly been a factor. But also look at beams of light that have come down, like, for instance, Sustainable Williamson, with Dino Beckett going back to his hometown and, starting high gardens and starting exercise classes and buying back buildings and renovating them and starting healthy restaurants. So you get great community leadership and great things happen. And we're seeing great community leadership sprout up all over West Virginia. And I think the key for us is to take those lights and light new candles in other communities, illuminate the opportunities that are there in any place, because even if you don't have a grocery store, we can create community gardens. We can have farmers markets. We can have food banks that help facilitate and bring, appropriate types of food to Dollar General stores and other places or to churches. And I think that it turns out that this is not just about one person and their health. This is about our community. And I'm not suggesting that people can just make a decision that, everything's good and I'm now thriving and no problems. But I think that for all of us, these are generational issues. And for us to be able to improve life in our state for our people over time, we have to change what we believe, and we have to start with all of our citizens, but particularly our youngest. And it is time for us to rally around this and to make sure that we are giving our children today and our citizens the kind of opportunities that will help them thrive.
I've known you for a couple of years. I know that you were born and raised here in West Virginia. You left the state, and now you've come back to the state. At any time during that spectrum, when you were practicing medicine, you have seen these national surveys or these reports, and you've seen West Virginia at the bottom. I guess my question is, how do you feel about that?
I'm a lung and ICU physician, so I've taken care of the sickest people of all in our medical center. But the thing that is my biggest passion is to figure out how we help people stay healthy and how we allow people to thrive. And so I've been through all of the social disparities of health, the food deserts, the jobs, the education, et cetera. But I believe that this issue about how we see ourselves, do we see ourselves as capable or incapable, scarce or abundance, fear or love or gratitude, I think that makes the hugest difference. And you see people that have resilience, get knocked down and get back up again, or you see countries that have raised themselves from real poverty, I mean, incredible poverty, to do much better. It is through hope. It's through education. It's through community. It's through helping each other. And I think that at some level, we have gotten out of balance with this. So I do hurt for our citizens in some ways, but I also know that the solution is not external to us. The solution is internal to us. And part of this is our opportunity today to help West Virginia just be the little engine that could, or the phoenix rising, because the best stories are the ones that end differently than you think they will.
Clay Marsh mentioned Dr. Dino Beckett and all the work he's done in Williamson, West Virginia. He's the CEO of the Williamson Health and Wellness Center, and he's a practicing family physician. Beckett says one of the things that the community needed to address was a lack of supermarkets and limited access to fresh foods in the area.
Well, there was Kroger's, there was a Piggly Wiggly, which is now Food City, and then there was, I think, an IGA as well. So,
and all of that's gone?
Yeah. There's actually, we just had a Dollar General open in West Williamson. That opened last month. So that's the first grocery store we've had in this area in quite some time.
And in many ways, for just regular folks here, they don't really have a lot of control over that.
No. I mean, and box stores are going to go where they have the population centers that they can get. They build the same kind of store. It's just that what are you going to make more money at a place that's in a bigger population center or in a rural place? So they're going to make decisions where to put those things. So we're not able to have any control over those. We were a food desert until we created a farmer's market. We don't have a grocery store in this part of Mingo County. There's areas that you're not getting access to a grocery store. But so we have done things to kind of create options for people. But that's definitely probably the biggest factor in healthcare. And then just overall, not real active lifestyles that have, kind of happened over the years. Once you become, have high rates of diabetes, heart disease, then you become inactive, and that just kind of worsens the problem as well.
Beckett says the region has high rates of diabetes. At the Williamson Health and Wellness Center, they offer health education for residents, and they also offer produce boxes filled with fresh fruits and vegetables.
We probably do over 200 boxes a month with different organizations to get to diabetic patients, to where they have meals that they get. It's got produce in it, plus it has an instructional guide on how to make the foods. It's got a meat with it as well. So those are things that we do to address our diabetic patients.
Beckett says licensed nurses make home visits once a week to check on high-risk patients. He says they have seen a big drop in patients' blood sugar A1C levels, which are key in determining how well someone is managing their diabetes.
We had a sustained drop for a year of 2%. So that's pretty amazing. If we were a medication, we'd have $1 billion drug. But we're using education. We're having the boots on the ground with these people interacting with the patients and helping them understand their diabetes and take control of that.
Beckett says sometimes the numbers can be misleading, and over time, the guidelines for diagnosing diabetes have changed. That means even though more people are diagnosed with diabetes now, they are managing their diabetes better.
They're able to control their numbers, and they're being active and doing things to help themselves from that perspective. So those are things that we don't look at a lot. It's just like, oh, we have lots of diabetics, which we do, and we're going to have lots of diabetics in West Virginia. But like I said, we have people that are aware of what's going on, and they're much better controlled.
Can you talk about what are other areas of health that indicate that West Virginians are not healthy? What other things are you seeing here?
Heart disease and obesity are big things. I mean, obesity goes back to the diet thing and compliance with diet. There are several factors that have happened over the years. We went through this fat-free phase where people were eliminating that. So there was a lot of increase in carbohydrates or grains in their diets, disproportionately. And, we had a lot of what you can see from the mid-'80s until, now how people's body mass index has increased significantly over that period of time as well.
I referred to that there are lots of traditional life patterns that I think have gone on for years in West Virginia. Has it been a challenge for you that in many ways people who've lived here for generations, they don't want to be told what to do? They don't want to be told that they need to stop smoking, or they don't need, you need to exercise more or eat healthy. Do you see that as a challenge and a barrier?
I do, but like I said, our population is incredibly resourceful, and once you give them tools to understand what's going on, they become engaged, and letting them know you can still do some of the things you want to do, but there may be some moderation with that. And when you look at West Virginia historically, I mean, there are times, there were reports when stuff was going on here with the mine wars, half of McCoy's. The reporters referred to the people here as flat bellies because they were incredibly fit. These were loggers, these were miners, and they worked with their hands. They were very physically fit. We've just had things happen over time that have allowed us to become a leader in the nation in obesity and diabetes and those things. But it's in our heritage to be very active. It's just reconnecting people to where they can go back and do their farming, do the things that they had their grandparents were doing. So, and connect them with that and that active lifestyle. It's not that you have to eliminate everything. We just want you to be more judicious with what you're choosing to eat and how that's going to impact your body if you do.
Craig Warren, who lives in Williamson, spent years eating his way to health problems.
It ain't gonna happen to me, but I'll be the guy sitting on the side of the road going, why does this always happen to me when I know it could happen?
Warren was diagnosed with diabetes in his 20s, but says he was young and stupid and didn't comply with what doctors told him.
What was the biggest challenge for you in getting your diabetes under control?
I know people gonna think this is stupid. I used to go to KFC and just order bread. I wouldn't go get the chicken. I would just go get bread. And I'm thinking, yeah, I got to cut that out. So I know people say that's crazy, but seriously, I go get biscuits. You don't want chicken with that? No, I want the biscuits. I told you I was stupid. The crazy thing about it, both my grandmothers, my paternal and my maternal grandmother, had diabetes. I knew. I think I was the one, I'm going to beat this, doing what I'm doing, knowing this ain't going to work.
Warren is a single parent to 2 boys. While his focus was on taking care of his family, his health fell by the wayside. He had a stroke when he was 45.
So you have a stroke, and that seems to be like perhaps the moment where you're saying, okay, I can't ignore the check engine light anymore, right?
Yes. Yes.
Do you remember the first things that they asked you do, I'm assuming that they said, Craig, you're going to have to make some changes in your life.
Oh, yes. I started out with them, and they sent me to a diabetic education class. And they showed me, okay, you can cook this, and you can cook this. And I'm thinking, oh, no, I can do this. But if they had just told me to do it, it wouldn't happen.
Dealing with diabetes and hypertension took a toll on his body. And in 2021, Warren had a kidney transplant. Now he drives to Charleston once a month for blood work to make sure his new kidney is functioning properly. He tries to make those trips during the day since diabetes has also damaged his eyesight.
I usually leave at 5 o'clock because when I get there, you have to do blood work, and I don't know how many people in front of me. I made up my mind this year that when I see them next month, I'm going up a day ahead, getting the room. I got uncles that they would take me, but I'm thinking, I'll just drive myself and stay, and then get up, go to the clinic the next morning, have blood work, and then head home when it's bright.
When I was at the Williamson Health and Wellness Center, I also met Melissa Justice, a registered nurse and certified diabetes instructor. Justice has known Warren for at least 15 years. They worked together at Williamson Hospital, where she was a floor nurse and he was a security guard. Warren has been going to the Health and Wellness Center since 2015. Justice says one of the best things about the center is that it gives people knowledge so they can actually make changes in their lives.
We just try to allow them to make the choice to become accountable for their own disease. So that being said, I just try to navigate him, and it's up to him to make the right choice to do so. He's figured out it's portion control. Like the cereals can raise one's blood sugar, all those carbohydrates in it, and then if you add milk to it, it increases it even more. But it's all about the portion control. Like, you have to be aware of how much you can eat. And you've also figured out if you go walk the walk track for 3 miles, it'll drop your blood sugar by how much?
What did you say?
No, it's what you told me. You said it'll drop you 50 to 75 points sometimes.
Okay. I'm going to get my son to walk with me because he said his knees hurt. And I told him, I said, if you take some of that weight off your body, you take so much pounds of pressure off your knees, man.
And you called yourself a big boy. Would you characterize your son as a big boy?
Oh, my son was in high school. He was running fullback at 200 pounds. He had a doctor's appointment today, and he wouldn't let me see the weight. But I'm sure it was up. It was higher than 200, a lot higher. 275, 280, and he's only 5'10". He knew it today. He said, man, I'm a big boy. I said, son, I've been a big boy my whole life. Even when I lost weight and was in high school graduating, at 200 pounds, I still was considered a big kid. You're a big boy.
Do you want to set an example for him to?
Yeah, I have to now.
Warren worries about one of his sons more than the other.
My son will go into Walmart and I say, get whatever you want. He'll come out with blueberries, blackberries, apples, strawberries. And he'll be in his room just munching on those. I said, you eat something? I eat my fruit. I said, okay, man. But my other one, I said, you eat something? Yeah, and then he'll go, no. And then I'll ask him, I said, you eat something? And it's like 4 a.m. He's talking about, I'm getting ready to fix something now. And I said, that's not good. But that's the difference.
The son that he's talking about that has gained all this weight, like he said, he used to play football. He was 200 pounds running back. So he decided to stop playing football. So he was not active, and then he increased his eating habits of the things that he used to work off during football. He's not, working off now, so he's gained the weight from that. So he's become more inactive.
Yeah, unless you count the Xbox.
The Xbox?
Yeah, he's active on the Xbox. And he shocks me by getting up and going to classes at the college. But other than that, he doesn't do anything.
Do you think Craig is having an impact on his kids?
I definitely do, because they see his struggles now. They saw the struggles prior to the transplant. They saw that he went and sat at the dialysis center for 3 hours or 4 hours a day, 3 days a week.
That was rough. Because some days when they took the needles out, they couldn't stop me from bleeding. So I would have to sit there maybe 30 minutes to an hour just to get them to stop. I'm thinking, that's 5 hours.
And after a transplant, that's been a big transformation.
Yes, I think it was a transformation on the entire family. I mean, I really do. It got the children thinking, what would we do without him? And his mother too. Like, she recently passed away a few years ago, and I think it's all had an impact on all of them. Stress, increased stress, and then Craig going through all he went through. I really think it had a bearing on their mind to change.
As regional hospitals close, plenty of people have told me about having to travel farther to receive care. But Melissa Justice says it's clear the impact the Williamson Health Center has had on Craig Warren.
Tell him what you call me, Craig.
I call her Jiminy Cricket.
Jiminy Cricket was Pinocchio's friend, who also acted as his conscience.
If I want to do something that I shouldn't, like eat something that I shouldn't, she's always on this side. You can't have that. Don't eat it. Don't eat it. I'm thinking.
Yeah, that's what he says. He said, I always hear you over here saying you have better choices. It's a team approach. You hear that it takes a community to raise a child. I think it takes a team to manage a patient. And if we provide that patient with the education and the ability to be, stand alone and own their disease and take part,
own their disease,
take part in that themselves, you can lead a horse to water, but you can't make him drink. You know what? You see where I'm coming from?
They couldn't make me drink before I got hooked up with them. They would show me the water, but I ain't thinking, I'm not thirsty.
We have myself a certified diabetes educator. We have a chronic care management team. We have wonderful providers. We have a dentist. We have a podiatrist. We have pediatric doctors and nurse practitioners. We have behavioral health specialists now for adults and pediatrics. I mean, we have a community here now that our patients, I guess you could say, in this little area, I don't feel like fall through the cracks, if you could say or would say, because someone is always looking out for their best interest.
There's a lot of talk about living in a rural place like Williamson, and that they are separated from a more high-powered hospital like what they would have in Charleston or in Morgantown or in Huntington. But that they might not have maybe the focused individual care that because there's not as many people, that Craig has gotten to experience. So in some ways, that might be an advantage, no?
I think here at this little facility, you're not a number, I guess you could say. I always try to treat people as I want my own to be treated. I don't know, there's no stone unturned, I guess you could say. We treat the whole and not just the patient himself. We look at the family dynamics and what's going on there, and the socioeconomic side of things and what's going on there. And we just treat him as a holistic person, because if the means is not there to manage the disease, then it's not going to happen.
Improving the diet and nutrition of Mountain State residents is only part of what it takes to improve overall health outcomes. It's also about getting people more active and improving access to a variety of exercise options. Programs like those in Williamson and Huntington have shown the importance of classes that empower people to make the lifestyle changes they need. Whether or not we have our own Jiminy Cricket sitting on our shoulder to guide our way, it's clear there's no one solution to improving the health of West Virginia. But for West Virginians to get to a healthier place, it is going to take some raising of consciousness and taking actions. You've been listening to Us and Them. Our team for this episode was me, Trey Kay, Samantha Gatzik, and Kate Smith. Michael Lipton, Tristam Lozow, and Ahmad Solomon wrote and performed the Us and Them show music. Mark Lerner designed our logo. The marvelous people at PRX and West Virginia Public Broadcasting make Us and Them possible. So do grants from the Corporation for Public Broadcasting, the West Virginia Humanities Council, and the CRC Foundation. We'd love to hear your thoughts about this episode. Share them with us on our Facebook page or on Twitter at Us Them Podcast. Us and Them was originally developed with assistance from the mentorship program at AIR, the Association of Independents in Radio. Stay healthy, everybody. We'll see you next time on Us and Them.
Support for this podcast comes from the Corporation for Public Broadcasting.